What if there was a path to recovery from addiction that really respected its complex medical reality, instead of just relying on willpower alone? Today, we're doing a deep dive into an approach that's doing just that. We want this to be a shortcut, really, to get you fully informed on this. Our focus is medication-assisted treatment, or MAT, and we're drawing insights from sources like primary care and telehealth providers, Stark Medical, for instance, looking at how MAT is delivered, especially using telehealth for folks in California.
Exactly. Our mission here is to really unpack this powerful tool. We'll explore how effective it is for both alcohol and opioid use disorders, and critically, how technology telehealth specifically is making it so much more accessible than it ever used to be. We're going to pull out the key nuggets for you, give you a clear picture.
Okay, let's get into it then. First off, the big question, what is MAT? And, why is it seen as such a game changer in addiction recovery?
Right. So medication-assisted treatment, MAD, it's a proven clinical approach for alcohol and substance use disorders. The core idea is combining FDA-approved medications with behavioral therapies. It's really a whole-person approach, and what really makes it different, why it's such a shift, is that it fundamentally recognizes addiction as a medical condition.
Okay, not a moral failing.
Precisely. That moves us way beyond those outdated, frankly ineffective, abstinence-only models. MAT works in basically four main ways. One, it cuts down those intense cravings. Two, it can block the euphoric or high effects. Three, it helps prevent relapse, which is huge. And four, it stabilizes brain chemistry during that really vulnerable recovery period. When it's done right, MAT demonstrably improves long-term recovery. It seriously reduces overdose risk. Some studies show up to 50% for opioids. That's massive.
Wow, 50%.
Yeah, it really helps patients get back control over their lives.
That reframing medical condition, not moral failing, feels really key. And that overdose stat is just, staggering. So hearing about this potential, how does it actually work on the ground? For specific things, like let's start with alcohol. How does MAT apply there?
Good question. For alcohol use disorder, or AUD, ME can provide real relief from those powerful cravings and the awful withdrawal symptoms. There are a few main FDA-approved meds we use. First, there's naltrexone. You might know the brand names, Vivitrol or Revia. It works by reducing the sort of pleasurable feedback you get from alcohol. Makes drinking less rewarding, less appealing.
Takes away the buzz a bit.
Kind of, yeah. It dampens that reinforcement cycle. Then there's a camprosate, or Camprol. This one helps more with stabilizing brain chemistry. It tackles those lingering post-acute withdrawal things like insomnia, anxiety, helps restore balance.
Okay.
And finally, there's disulfiram, Antabuse. This one creates a pretty unpleasant physical reaction if alcohol is consumed. It acts as a strong deterrent, really.
A behavioral nudge, almost.
A strong one, yes. And importantly, these can often be managed through telehealth prescriptions, monitoring, even counseling, all done virtually.
So naltrexone reduces the reward. A camprosate helps the brain heal. Disulfiram is a deterrent. That's quite a toolkit. Now, switching gears. The opioid crisis, that presents some unique hurdles. How does MAT tackle opioid addiction, whether it's, prescription painkillers or heroin? What's different there?
Right. MAT is extremely effective for opioid use disorder, OUD. The main medications are a bit different here. You got buprenorphine, often in formulations like Suboxone, Sublocade, or Zubsolvi. This reduces cravings and withdrawal, but also has properties that prevent misuse. It's what's called a partial opioid agonist. It sort of occupies the brain's opioid receptors, stabilizing things without causing that intense high.
Okay, so it satisfies the receptor without the big rush.
Exactly. Then there's naltrexone again, often Vivitrol for OUD too. But here it works differently than for alcohol. It fully blocks the euphoric effects of opioids. If someone uses opioids while on it, they just don't get high. And it's non-addictive itself.
Ah, interesting distinction.
And then there's methadone. This is usually provided through certified programs, often requiring daily visits for dosing, providing a very structured approach. Our sources really highlight the rise of outpatient buprenorphine treatment through telemedicine, though. This lets patients start or continue recovery without needing those daily clinic visits.
That seems huge for access.
It is. It's making
Yeah.
a massive difference, especially for people in rural areas. Integrating MAT for OUD into primary care via telehealth. That's a big step forward.
Right. Methadone needing the daily visits contrasts sharply with the telehealth options for buprenorphine and the alcohol meds. That access point feels critical. So talking about access, how is technology, telehealth specifically, really changing the game here? How's it reshaping treatment?
Oh, it's genuinely one of the most significant shifts in modern addiction care, delivering ME via telehealth, I mean. It allows for secure, iPay-compliant appointments pretty much anywhere with an internet connection, like statewide in California, as our source mentions. It just breaks down so many old barriers.
Like what specifically?
Well, first, the sheer convenience. Patients can have appointments from home, from a private office, wherever they feel comfortable. No travel time, no taking huge chunks out of the workday. Then there's accessibility. This is maybe the biggest one. It removes the need to travel. Think about someone in a rural area, miles from a specialist, or someone with mobility issues.
Right, removes huge obstacles.
Exactly. Obstacles like just finding a local specialist or dealing with long wait times, the cost and time of travel. Especially for communities that are already underserved. Telehealth just cuts through that. Plus, there's privacy. No sitting in a clinic waiting room. It's discreet.
That's important.
Very. And finally, it supports continuity of care. Regular check-ins, medication adjustments, all with the same trusted provider, just done remotely. And really all you need is a smartphone or a tablet, a computer with internet. It's amazing how it levels the playing field for access.
It really does sound like it removes so many traditional roadblocks, almost like a quiet revolution in healthcare delivery. But it makes you wonder, who is Matt really for? Is it the right fit for everyone? What about someone who feels like, they should be able to just tough it out?
Yeah, that's a common thought, and it really touches on the stigma that still exists. Matt is particularly well suited for a few groups. First, obviously, anyone really struggling with alcohol or opioid use disorder who wants a safer, medically supervised way to recover. It's also really valuable for people who tried quitting on their own, maybe multiple times, but keep experiencing relapse. Matt can help break that cycle
How so?
by directly addressing the physical side, reducing cravings, stabilizing brain chemistry. It makes relapse less likely. It's also crucial for anyone who needs help managing those intense cravings and withdrawal symptoms. The medications make that process much more bearable, making sobriety feel more achievable.
Makes sense.
And importantly, it's for anyone wanting to reduce their risk of overdose or other serious health issues. We mentioned the opioid overdose reduction. It can literally be life-saving. Finally, it's for people who want that comprehensive medical approach. They see addiction as a health issue and want treatment that reflects that, combining the medication with counseling, support, the whole package. So whether you're just starting recovery or looking for more support to stay sober long-term, Matt can likely be tailored to help.
That really drives home the point, is a medical approach for a medical condition. Okay, so for someone listening now, maybe considering this, what does the actual process look like? What's the typical journey with telehealth, Matt?
It's generally set up in 3 key stages, designed to be pretty straightforward and supportive. Stage 1 is the initial evaluation. This starts with a comprehensive telehealth visit. A specialist, like the Dr. Stark mentioned in our source material, will review your medical history, your substance use history, talk about your goals for recovery, and based on all that, they'll figure out which end medication, if any, is the best fit for you.
All done remotely.
Yeah, all via secure video call. Then comes stage 2, medication management. Once you have a plan, they'll send electronic prescriptions right to your local pharmacy. Easy pickup. Then you'll have regular telehealth check-ins. These are for monitoring how you're doing, making any needed adjustments to the medication or dose, managing any side effects, that kind of thing.
Okay, ongoing support.
Exactly. And that leads to stage 3, therapy and support. This is critical. MedMat works best when it's combined with behavioral therapies. So the provider will help coordinate that. They might offer counseling directly via telehealth or refer you to mental health support, maybe recommend 12-step programs if that's right for you, teach mindfulness techniques for cravings. The idea is to ensure you have access to a whole range of recovery resources, all coordinated.
Right, so it's definitely not just about getting a prescription. It's an integrated plan. Makes
Right.
sense. So final push here. For someone listening, why start Matt now? What's the risk of delaying versus, taking that step today?
Well, delaying treatment carries some pretty significant risks. There are the ongoing health complications from continued substance use, obviously. There's the ever-present and frankly terrifying risk of accidental overdoses, particularly with opioids. It can happen to anyone, anytime. And beyond the physical risks, delaying often means more strain on relationships, problems at work, potential legal issues, financial troubles. It spirals.
The costs add up quickly.
They really do.
Yeah.
On the flip side, starting Manette today means you begin turning that around today. You start the process of reclaiming your health, your stability, your future. It's about taking back control proactively.
This deep dive has really shown, I think, that medication-assisted treatment isn't just an option. It's a really comprehensive, medically sound path to recovery. It's that whole person approach, using effective meds with behavioral support, and the telehealth part. Wow, that's making it reachable for so many more people.
That's absolutely right. The benefits we talked about, the convenience, the incredible accessibility, especially for rural or less mobile folks, the privacy telehealth offers. It's transformative. It means expert, personalized care is available for people struggling with alcohol or opioids, no matter if they're brand new to recovery or needing help maintaining it long term. It really is a powerful combination.
When you step back and look at the bigger picture, what really strikes you about how technology like this is fundamentally changing medical care? Especially for tough chronic conditions like addiction, what new possibilities is it opening up? And I'll leave you, our listener, with this final thought to chew on. Think about what happens when we truly shift perspective, when we understand addiction as the complex medical condition it is, not as some kind of moral failing. It completely changes the game, doesn't it? It opens up these evidence-based paths to healing, paths built on science and support. And now, incredibly, many of those paths start right from the privacy and comfort of your own home.